Good morning, everyone. You definitely prefer me to speak rather than sing or play an instrument, so I think I'll just get going. One clarification, a really important clarification for you in Missoula. My undergrad is from here, through the School of Forestry, actually, at the U of M. Graduate degree in Bozeman, based in Bozeman. So all of you students out there, believe it or not, there is international work to be had in our great state of Montana. So how clean water, and I'm sorry, another clarification, and we need to update our website, apologies. We're in over 70 countries globally now and growing just about every week. We have inquiries from all over the world, and I'll talk about that. So how clean water and hygiene practices promote global health? A little bit about the water situation, and forgive me if this is a repeat, but in my mind, there's no question that there's nothing more important than understanding the facts associated with the scarcity of water around the world. So as you can see, more than 1 in 6 people worldwide have access to less than 5 gallons a day. Guess how much we use in the US? Guesses? Per person, how many gallons do we use a day? It's about 100. Yeah, it's about 100. And it adds up fast when you flush the toilet and do a load of laundry, take a shower, brush your teeth, you know, water your lawn in the summer. Those kind of things add up very, very quickly. So we heard about this from Dr. Fitch, was really an amazing presentation. I'd love to hear Dr. Fitch, we never really got back to the innovation part, and I was gonna ask the question, but I'll catch you later. The rolling canisters of water, I thought that actually was going to take off, so I'm very interested to hear the latest on that. But as you can see, in developing countries, oftentimes women fetch water from, well over 3 miles. It's fairly common. There have been some great inroads pushed through those Millennium Development Goals that started in 2000, and there's been some really wonderful success stories, but there's a long way to go. The other side of that equation, the clean water equation, is the sanitation side, and this is unfortunately much worse. So on the sanitation side, over 1 billion or almost 1 billion children live without adequate sanitation, and mostly in the developing world, but we'll talk a little bit later about some experiences I've had. So, staggering numbers, 3.5 million people each year die from water-related diseases. Think about that. Most of these are treatable. Certainly through clean water and sanitation, much of them can be prevented. So hand washing is one of the main keys and really one of the stalwarts of our education programs that we deal with at Project WET in our WASH program, which is Water and Sanitation Hygiene. A significant portion, at one point the World Health Organization said 47% of diarrheal disease can be reduced. I think they backed off that just a little bit here recently. But as you can see, hand washing is a critical component. On the side there in the picture is what we call a tippy tap, and we'll talk a little bit more about those later, but it's sort of a rudimentary technology, speaking of innovation, for creating hand washing stations on site outside of restrooms and around communities. So our vision at Water Education for Teachers, or the Project WET Foundation, since 1984 has been to bring water education to children, parents, teachers, and communities of the world. Simple as that. We do it in many ways. First of all, we create award-winning publications and curriculum, and it's really the backbone of what we do. Everything we do is hands-on and interactive. So I encourage any of you who are coming to the Progressive Dinner tonight, the water session, we'll be doing lots of these interactive activities during the meal, just to give you an idea of the exposure that we give to students around the world. So we provide training workshops to diverse audiences all over. We organize community events, and most importantly, the question came to the panel earlier about partners. We can't do this without partners. So in these 70 countries and all 50 states where we have Project WET partners, we reach 30,000 teachers every year in training workshops. So that's every year. Over 1 million children are reached with these important lessons. annually. And we do that with a staff of 12 there in Bozeman. And it's because we have hundreds of partner organizations, governments, UN agencies, the big ones, UNICEF, CARE, and tiny NGOs and orphanages and people like that who work with us. So they talked a little bit about the educational stages and the action education piece, and I just wanted to give you a quick overview of how we look at it. Sort of the awareness and understanding piece, the awareness and knowledge piece is at the bottom, and that's where we start. So we raise awareness in these rural villages in Uganda, for example, about the importance of hand washing, because it's not a common concept there. For those of you who have been to East Africa, for example, handshaking is a really big deal. You can have an entire conversation holding hands with the person that you just saw the night before you went to bed, and they may have literally just picked their nose or sneezed in their hand or whatever. This is fairly common practice. No issue there. The problem is the hand washing side isn't as common or hasn't been as common there, and I'll show you some figures in a bit from a school we worked with. So the awareness and knowledge is a key component. Certainly the attitudes that come out of that, people start to understand the value of these pieces. We even give them the skills, how to build a tippy tap, the World Health Organization guidelines for actually washing your hands, which is how many seconds should you wash your hands? 15, someone said? Anybody know? Wow. How many people sing while they wash their hands? What do you sing? Happy birthday twice. It's 20 seconds is the minimum number of seconds. And of course, washing with water is fine, right? You gotta have soap. We have all kinds of lessons around the value of soap and the hydrophilic and hydrophobic properties. And anyway, 20 seconds with soap, scrub hard, please. So then we get into the participation phase, and this is sort of the action education component. We want to not only give people the skills and knowledge and understanding of why they should do something, but then get them to, and motivate them basically to start taking local actions. So in one village in northern Uganda, we went back a few months later after our implementation, and there were tippy taps everywhere. There were tippy taps outside of every home, tippy taps at every latrine, tippy taps at the community center, at the church, and all of this was a result of really just this awareness raising, tippy tap being a hand washing station. So that's the end goal. We want to motivate people to local action. So speaking of goals, the WASH project goal, again, water, sanitation, hygiene, to bring about significant change in attitude and behavior of people, especially for our audience, which is K-12 schools and communities in relation to water and sanitation. A quick primer for those who haven't been, and I apologize, I talk about Africa. Those who have been there know that there's no Africa. There's countries of Africa, there are tribes within a country, there are regions, there are local dialects and languages. But for this audience, in this case, I'll just talk about Africa because I am sort of generalizing, but to give you an idea of what schools look like there. Most times in rural Africa, dirt floor schools, which leads to all kinds of problems with bug infestations. Oftentimes the students are barefoot, they have bites throughout the day, it's sad. Bathrooms, these are relatively nice, actually compared to many that we've seen. These are actually constructed. Oftentimes, one of the challenges we see with the restrooms and latrines are that they're not co-ed. And there's a major push now in the development agency world to deal with menstrual hygiene management, because girls, as they hit puberty, are finding that the facilities are grossly inadequate, and they're actually staying out of school instead of going to school during their time of their period. So it's a big issue. They're also finding the same with teachers who are missing school literally, just not showing up for the same reasons. So the school drinking water and sanitation, this gives you an idea of what the water situation typically is like. Oftentimes it's just a tap. People are carrying containers of water. Let's say that's clean water coming out of the tap. We hope so. Is the container clean? This is another big question, right? You put clean water in a dirty container and it's still dirty. So all of these things are considerations. So our implementation came, and I don't know if I said this, but we've been doing this since 1984. We've been working here in Montana and doing all kinds of things around the U.S. and globally. But USAID did a global search for a water education organization to build materials to reach these East African communities. That was in 2007. They chose us. Wonderfully, we created some award-winning materials, and by saying we, I really mean 2 or 3 of us and about 50 Ugandan teachers, health educators, ministry officials, and NGO partners who we gathered for a full week there in Jinja, Uganda, and worked together and really understood the local context. They actually wrote the lessons for us. I mean, this is how we work. It's not, John and his team sitting in their office in Bozeman trying to figure out what the situation is. We really go to the end user to start. So then we created these hands-on activities. As you can see, many pieces, interactive posters, teacher guides, student booklets, and then we started the implementation process where we worked in the train-the-trainer process to distribute these. And this map shows just in this one project through USAID what we were able to reach. And speaking of partnerships, one really important part was the Ministry of Education buy-in. So we got I don't know what you call it, sort of letters of approval, acceptance by ministries of education in most of these countries in which we're working, which is a really important part because they're typically a top-down education system over there as opposed to a decentralized like we have. So the workshop methods, just like tonight at dinner, we actually treat the teachers just like students. So they go through an activity on hand washing or water quality, water purification, as if they were the students. They are given the materials, we have some practice time, then they're actually moved over to the students. So that train-the-trainer model, which is certainly no innovation, this has been done forever, is the model that Project WET has been using to reach all of these people that I mentioned earlier. So it starts, in this case, a state coordinator. It could be a country coordinator or local coordinator. They have trainers, or what we call facilitators. The facilitators teach the teachers teach the students year after year. The facilitator may do 5 workshops a year with numerous different teachers, and pretty soon the scale-up happens very quickly, as you could imagine. So then the teachers take it to the students. The innovation here is truly that the curriculum that they're teaching is very different from what the typical pedagogy that they were using before. For those who have been there and interacted with the schools, the curriculum materials that they have, in a way, are incredibly advanced, and to me it was shocking to see what they were expecting second graders to understand in Ugandan schools, for example. The school system in Uganda, based on the colonial British rule, was still sort of the UK system, and they were asking them to understand chemistry and properties that were far beyond anything that our second graders here in the U.S. would do. Not that we're any smarter or not, but I just felt it was way out of reach. So regardless, we have these hands-on lessons that are a new pedagogy, very well accepted, lots of fun for the kids, and they actually learn. So you may be thinking, all right, well, how did this little group in Bozeman, get into this deal? Well, USAID found us, and from that point, UN Habitat, there are many, many UN agencies that deal with water. Habitat focuses on the urban environment. They saw those materials, said, hey, can you do this in Latin America for us? My colleague Julie in the back led the project to deliver it to 5 Latin American countries. Then India, under the UN Habitat flag. Abbott Pharmaceuticals came in, believe it or not, and said, hey, this stuff is great. Can you do this for the favelas of Rio? You're probably hearing a little bit about those favelas right now with the Olympics, as well as the polluted water that's out there that the swimmers are going to be in for the Olympics. Well, most of that pollution comes right off those hillsides in which, where we were working. So China, Mexico, US, and Germany. Ecolab is also another health-related company, came to us a couple years ago and said, can we do a water conservation, clean and conserve, basically, hand washing, sanitation, surface sanitation, and water conservation curriculum that we can push out into 4 primary markets, including China and Mexico, in the developing world, but also into many, many dozens of sub-markets. And then very interesting, and this may surprise you guys, but Levi's, as in Levi's jeans, came to us a year ago and said, gosh, you guys do great work. Can you build something for us around water conservation and water footprinting, which wasn't necessarily related to WASH. And then just this year, I was in Sri Lanka about a month ago, working at their very farthest end apparel production factory, you know, what I would have thought was a sweatshop. Turns out it was not a sweatshop at all. It was amazing, cool, bright, people working in teams, you know, no sort of hovering over sewing machines. It was fascinating. But anyway, there are some serious WASH situation sort of deficiencies in the community around that factory. So what they wanted to do was to train the factory workers in these basic sanitation hygiene principles. They brought us in to do that, and it was fantastic. And now they have committed. In fact, I was at the White House a couple weeks ago on World Water Day with Levi's announcing the fact that they are committed to 100% of their employees around the world going through this Project Wet training for this tiny little NGO in Bozeman, right? So in addition to that, scores of government agencies, tiny NGOs, as I mentioned, schools, et cetera, work with us. So we customize these materials culturally. It's so incredibly important that we have the voice of the end user and those teachers and really understand. You know, I'll give you an example. Going back one, these 3 publications are all for different countries in Latin America, and unbeknownst to me at the time, there's not one Spanish for Latin America. The Spanish languages are very different between Colombia, actually, you know, sort of lowland and upland, Bolivia and Colombia, et cetera. Very different cultures, very different styles, very different water situations. So we adapted to all of that, and you can see the Mexico, what we call the Mex anime version up there. They wanted their own illustrator, which is fantastic, and that's how they like it, and that's how they got it. So this is for India, just to give you an idea how it looks in different cultures, and of course we customize throughout. So how did it go? There was a targeted pilot in northern Uganda. 85% of the schools showed increased hand washing with soap and water. Afterwards, this was through third-party evaluation. 67% of the schools had increased rates of hand washing after latrine use. So just a little bit about the attitudes piece. Since we received the materials and brought them home, our mother does not allow us to drink water that is not boiled. Wow. Think of the power of that statement. For the first time in their lives, literally, their mom is saying, you're not drinking that water unless it's boiled or treated. This is the one I mentioned earlier, this hand washing piece. In Entebbe, Uganda, it's a relatively advanced school there, but even with that, they had one tap, they had water, but only 5% of the 1,200 kids that go to the school wash their hands in a day prior to us, you know, working with the teacher there to implement the curriculum. Afterwards, it went up to 38%, still not high enough, but it's a whole lot more than 5%. They've done a lot of amazing things since. So one of the challenges has been, and speaking of innovations, sort of gathering data in these rural societies. There's no internet there, there's no Wi-Fi, certainly back in 2010 and 11 when we were collecting the data. So we were able to work with a MIT PhD candidate who had a way of sort of robo-calling people, and we had a recorded survey in Ugandan voice that was sent to 250 teachers who participated, out of the 500 who participated in the workshop. So lots of trial and error in this, but they would literally receive a phone call, hey, how many students have you received this with in the local language? What's been the result, et cetera, et cetera, et cetera. In our little computers in Bozeman, we were able to actually hear the responses to these questions and translate and everything else. It was amazing. So the challenges are many with trying to gather data in those remote areas. But here's the last thing I'm going to end with. Thank you. It's not just the developing world anymore. We saw some amazing maps. Thank you for those of where Zika is now potentially going to be. Waterborne diseases are here, not only Zika, but dengue in the southern states, West Nile here in Montana, chikungunya, all mosquito-borne schistosomiasis certainly coming in. I can't wait to hear Marshall Bloom, who I've worked with in the past on whirling disease, talk tomorrow. And I'm going to leave you with this. So here we are in the developed world of the U.S. We are potentially facing some of these same sanitation and hygiene challenges related to these diseases. What can we teach? We can teach hand washing. That helps for everything. I think we have a really high rate of hand washing in the U.S., although sometimes it amazes me to be in the men's room and see how many people walk out without. Certainly mosquito prevention, standing water, all those pieces. In India, we teach them to break coconut shells in half to keep the standing water low, because it's real common for them to drink coconut water. Bug repellent, et cetera, and certainly the awareness and understanding vector life cycles, et cetera. So with that, thank you so much. It's great to be here.